Right. So this legislation comes before us every year, and insofar as we continue to operate a two-tier system of health in this country, which we believe is fundamentally wrong, this legislation goes towards trying to keep premiums down for health insurers that would have a bigger cohort of older people, as I understand it, and particularly the VHI, in order they don't have to put the premiums up for older people. So, yeah, within the parameters of a fundamentally unfair system where huge numbers of people are forced to take out private health insurance, we would support this minimal measure to try and equalise the premiums. But obviously, much of the debate that I've heard, rightly, and it's certainly what we would say every year, is it highlights the urgent need to get away from the two-tier system, which by and large I think people are forced into. The very high level, just under 50% of people who feel the need to take out private health insurance to pay very hefty monthly insurance premiums, which are a very significant burden on people, it's worth saying. I mean, one case of a family that was being made homeless recently who were elderly, sorry, not elderly, they were in the late 50s, early 60s. It's not elderly these days, really, is it? But they would have had health issues in the family, and they were being evicted through no fault of their own from their family home. And a significant part of their outgoings were private health insurance. But they were absolutely, terrified about the prospect of not paying their health insurance because the husband had a heart condition, serious heart condition, and his partner also had health issues. So for them, that's money they have to pay because they're terrified of having to rely on the private health system because it's such a mess. But that money is also money that they desperately needed to try and find alternative accommodation to avoid being homeless. And they've been living under the terror of being homeless when they're seriously unwell, but feel obliged to pay private health insurance because of the terrifying prospect of of them needing the health system to deal with the illness. And indeed, much of the conversation I had with that particular family during the course of the threatened, the eviction that did go ahead, and they were evicted from their family home where they'd lived all their lives with their two children, but much of the conversation with them was literally their fear they were going to die because of the stress. And these were working people. But in trying to assess their income, and it might be something you look at, they couldn't get on the social housing list, so they had no options because their income was over the threshold. But a very significant portion of their outgoings was actually money going for health, private health care, insurance against the possibility of being ill. So it's not money they had in their pocket, but it was money that was counted by the local authority to say you're not entitled to social housing. And as a consequence, you're entitled to absolutely nothing. So there's a lot of working people caught in that bind, paying large amounts of money for something they shouldn't have to pay for which they are actually paying twice. That's the reality of private health insurance. You're paying twice. And what are you paying it for? Well, critically, you're paying it to make an awful lot of profits for private health insurance companies. That's really what you're doing for private companies who want to exploit people's fear of having to be put on a waiting list where they could be waiting months or years for treatment. And it's worth noting that if you take Leia Healthcare, for an example, pre-tax profits up this year from 28.85 million to 36.55 million. So private healthcare making lots of profits, essentially out of the fear and terror that working people have of having to rely on a public health system that is in very, very significant trouble, and where that private system is pulling resources and public money in order to make, as well as taking huge amounts of money from working people to pay the premiums, it's also pulling resources and money from the public system. If you take the National Children's Hospital as an example of that, a hospital that's what it's expected to cost now, over €2 billion, but included in that are consulting rooms for private healthcare. So the public paying €2 billion for this state-of-the-art National Children's Hospital, but public money actually being used to subsidise a two-tier private healthcare, to make money for the private consultants, to make money for the private health insurance companies, and to force working people who feel compelled to take out private health insurance to pay twice. To pay with their taxes, which they already do, and then to pay again with hefty private health insurance premiums. And the worse that the crisis gets in the public system, the more people feel the pressure to go into the private system, and certainly you could understand why people do feel compelled to do it. I have to say, as a matter of principle, I do not and never have and never will take out private health insurance because I believe it is fundamentally wrong, and I think it's particularly wrong for public representatives who are charged with maintaining the public health system to in any way sort of benefit from a two-tier system. Surely if we're going to represent the majority of people in this country, we should be the ones who have a personal incentive to ensure that the public health system actually functions for everybody. And a couple of comments on just how bad things are in that regard, which, more evidence about why people might be pushed towards the private healthcare system, that the INMO are feeling compelled now, not something they want to do, to consider industrial action because of the recruitment freeze that the government have imposed against a background where the INMO reckon that we are 2,800 jobs short of where we need to be in terms of having the nurses and midwives we need to actually make the health system function. The Irish Hospitals consultants are saying that the government are significantly behind the 10% reduction in waiting lists that they promised by the end of 2023, already facing a 65,000 shortfall by the end of September. There are 893,000 people on some form of National Treatment Purchase Fund waiting list, which is up almost 23,000, 3% this year alone, and by an additional 309,000 plus 53% people since Sláinte Care. The IHCA President, Robert Landers, said the 2023 waiting list action plan is now unlikely to achieve the reduction target set for the end of the year. The government needs to urgently increase public hospital capacity to address the increasing number of patients on waiting lists. So, all the fear, all the things that would lead people to feel they have no choice but take private health insurance. And then, of course, as I have mentioned previously, you have the advertisements week in, week out for the Beacon and for the Blackrock Clinic, which essentially the subtext of those advertisements is if you come to us, you don't have to queue. If you go to the public hospital, God help you, because you're going to be sitting on a trolley or be put on a waiting list for weeks and months. One last thing I just mentioned is an awful lot of people now are having, in terms of occupational therapists. I mean, for example, if you need to get housing with certain types of adaptations, you need occupational therapist reports, or even to get your wheelchair fixed if you're disabled, as someone informed me recently, you need an occupational therapist. But there's hardly any occupational therapists available in the public service. In Dún Laoghaire recently, they actually cut to 1 day a week, I think it is. Sorry, 2 days a week. Used to be 1 day every day. There was one every day for an hour. You could ring somebody up in the local health centre to say, I need to service my wheelchair, I need a new wheelchair, or whatever. Now that's been reduced to only 2 days a week because of lack of occupational therapists. So, you know, these are the kind of basic things where the lack of staffing, the failure of the government to address the staffing crisis in our health service is terrifying people, and people end up having, in one shape or form or another, to go private, and that is not acceptable. Healthcare first should be for everybody.